The term dementia is a term about what the brain is doing as a whole and how we're seeing it and responding to it as a whole, rather than looking at the underlying causes alone. And the reason that's powerful is because it addresses the experience of the individual, the experience of the family.
I use the term childhood dementia based on the feedback that I've got from families. And the families tell me that it's a useful term because individually, among the hundreds of conditions that are grouped under childhood dementia, people aren't aware of what that diagnosis means and what it entails.
For us, the value in the term childhood dementia is it's understandable by most people. They know that dementia carries with it a sense of a loss of function, that there are cognitive aspects to that, there may be behavioural and mental health aspects to that.
I could talk about a whole number of very rare conditions which no one might have heard of, but most people would have heard about the term of dementia.
There has to be a lot of care in how that term's used at an individual family level. Depending on where in that journey a family, a child's diagnosed, they might not actually have a dementia phenotype, if you like, a dementia set of symptoms at that point in time.
I think it has to be used very sensitively to a family to really take the time to explain why you're using that term.
I can understand why some health professionals might find the term childhood dementia a little bit difficult to use to some families, a little bit challenging. However, I don't see that the concept of childhood dementia as being more challenging than telling a family that they've got Tay-Sachs or Batten's disease or any one of these number of unfortunately devastating conditions.
If we're not using layman's terms, if we're using medical jargon, we're kind of hiding behind that in a way and protecting ourselves. It gets in the way of the family's understanding.
These families will be distressed, and that's difficult to start with, but not facing the truth is even more difficult.
We don't have any locally approved disease-modifying drugs for adult dementia. My sense is, and I'm hopeful, that we will end up having perhaps some for childhood onset dementia before we do for adult onset dementia. But I think at least being able to frame it in those terms allows us to approach regulatory bodies and funding bodies and give them a sense of really the urgency of the clinical problem.
The most efficient and powerful thing we can do for rare diseases is to look at commonalities. The diagnostic odyssey, be it the challenge around care coordination, be it the isolation and mental health burden, being it better linking to palliative care. So by looking at those common challenges across groups of conditions, we can make transformative impact.